All right, let's talk about a really interesting and powerful antibiotic called clindamycin. Now, this isn't your everyday first line of defense kind of drug. Think of it more like a specialist, a highly skilled expert that doctors call in for some very specific and often pretty serious situations. So let's dive in and figure out what makes this one so special.
So let me start by asking you a question. What on earth could a common skin problem like acne, a serious lung infection like pneumonia, and a parasitic disease like malaria all have in common? I mean, they seem like they're from completely different worlds, right? Targeting totally different parts of the body in very different ways.
Well, believe it or not, the answer is that all of them, in the right situations, can be treated by clindamycin. It's a perfect example of how specialized medicine can get. And that's what we're going to break down here. What exactly this drug specializes in. Okay, so to really get clindamycin, first you got to know its target list. Just like any good specialist, it doesn't just go after everything. Nope, it has a very specific set of enemies it is designed to take down. And that list is surprisingly wide-ranging. We're talking about all sorts of things, from nasty skin infections to really deep bone infections. It gets used for certain kinds of pneumonia, serious infections you might get in your teeth, and even as a cream for acne. And get this, it even helps fight malaria when you pair it with other drugs. The versatility is pretty amazing. So here's where we get to its real specialty. Clindamycin is an absolute powerhouse against bacteria we call gram-positive, like staph and strep. It's also great against anaerobic bacteria, which are the kind of germs that can live without any oxygen. But, and this is a huge but, it's pretty much useless against most gram-negative bacteria, like E. coli. And knowing who its friends and foes are is absolutely critical for a doctor trying to pick the right weapon for the job.
So, how does it actually do it? What's the secret weapon that clindamycin uses to knock out its targets? Well, it all comes down to something we call its mechanism of action.
Now, mechanism of action sounds super technical, I know, but all it really means is how the drug gets the job done. It's the step-by-step process of how it works inside a tiny bacterial cell to stop it. Simple as that.
And clindamycin's strategy is brilliant. Think of a bacterium like a little factory, constantly building proteins just to survive and make more of itself. Well, clindamycin is like a saboteur. It sneaks inside the factory, finds the main assembly line, this key part called a 50S ribosomal subunit, and just jams it up completely. It shuts the whole factory down. And if the factory can't make proteins, the bacterium can't grow, it can't multiply, and the infection gets stopped dead in its tracks.
All right, so we know who it's after and how it works. Now for the practical stuff. Let's look at the user manual. How do doctors actually get this drug to patients?
One of the really useful things about clindamycin is how many different forms it comes in. You've got your standard oral capsules, pills. For really severe infections, it can be given through an IV in the hospital. There are even topical creams and a liquid version that's much easier for kids to take. Super versatile.
Now don't worry, I'm not going to read this whole chart to you. The big takeaway here is just how carefully the dose has to be calculated. This is not a one-size-fits-all drug. You can see the dose for kids is based on their body weight, which makes sense. And the IV doses are way higher than the oral ones. That's reserved for when things are really serious. It's all about getting the exact right amount of medicine to the right place. Okay, but with any powerful tool, there are always risks. And this is the really important part. We have to read the fine print. So what are the side effects and the potential dangers of using clindamycin?
So a lot of the common side effects are kind of what you might expect with any antibiotic. We're talking about things like diarrhea, feeling nauseous, maybe some stomach pain or a skin rash. For most people, this stuff is manageable, just part of the deal.
But there is one risk that really stands out from the rest. It's a big one. So big, in fact, that it completely changes how doctors think about when and if they should prescribe this drug. And that risk is a very serious condition called C. diff-associated diarrhea, or CDAD. So here's what happens. The antibiotic doesn't just kill the bad guys causing the infection. It can also wipe out all the good protective bacteria living in your gut. This creates a power vacuum, and a really nasty bacterium called C. difficile can seize the opportunity to grow out of control. This causes a severe and sometimes life-threatening inflammation of the colon. And clindamycin, unfortunately, has a reputation for being one of the bigger culprits.
So because of that huge risk, there are definitely people who need to be extremely cautious. I mean, an allergy is an obvious one. That's a hard no. But just as important are patients who've had this kind of gut inflammation from antibiotics before, or people with conditions like inflammatory bowel disease.
For these groups, the risk might just be too high.
Which leaves us with this delicate balancing act. On one side, you have this uniquely powerful weapon against some really tough infections, but on the other, you have this significant risk of causing a different and very serious problem. And that leads to the ultimate question that doctors and patients have to face together. When is the reward worth that risk? It's a tough calculation, and it's right at the very heart of what modern medicine is all about.